practitioner.
Medical practitioner.
Yes.
So take it over.
Thank you so much, Eric. And of course, if you have any questions regarding our topic tonight, tweet us at K24TV. Dr. Timothy Olwen is with me tonight. Karibu sana to the studio.
Thank you very much.
Now, before I start and ask you my first question, Githogori Yunus on Twitter says, hiyo ndio ugonjwa gani na Kiswahili? Okay. I don't know if it has another name in Swahili, but can you please explain to us what is a medical misdiagnosis?
I think medical misdiagnosis, to start a diagnosis, is the process, and I emphasize here, it's a process of establishing what underlying disease or condition can explain a patient's signs or symptoms. That is what a medical diagnosis is. The word medical here implies it has to be by a medical professional, because you have other diagnoses also that are made by people who are not medical professionals. And so we can't talk about medical misdiagnosis in that realm.
Right.
Now, so in essence, when we call it a misdiagnosis, it means we didn't get something right. Mm-hmm. And there are various reasons as to why. I've emphasized the fact that, first I'd like to mention that medicine is actually not a science, as a lot of people believe. Medicine is also an art.
It is?
It is an art. Medicine is an art that is based on applied science. So we use the principles of pure sciences, but it is an art. And that's why even in the Hippocratic Oath, it actually calls medicine an art. Mm-hmm. So that is why it's something where experience and skills come in. And the essence of the art component especially is the relationship between the doctor and the patient.
You mentioned experience. Do we have experienced doctors in the country?
Yes, we do. They are not enough, but we do have experienced doctors. Mm-hmm. And that's a challenge, I think it's a challenge worldwide. Of course, we have a challenge in terms of not having sufficient medical professionals, and it's something that I believe is being worked on. But the bottom line is we have to work with what we have. I think what is most important is that we optimize the use of the resources we have. And I'm talking about the human resources and the infrastructural resources in terms of technology and so on, so that we minimize the circumstances in which we have misdiagnosis.
Is it the same definition as a medical malpractice? Are they both the same, or it's a different meaning?
Medical malpractice, I think, is more leaning towards a legal term. And malpractice is defined as when you have a misdiagnosis or somebody ends up not being managed the way they should, but intrinsic in that definition is that there has to be harm that can be associated, causally associated. In other words, the misdiagnosis caused the harm the patient suffered. Mm-hmm. So that is malpractice. But the other part of malpractice in terms of definition, it has to be that the medical professional did not do things to a standard that is regarded as reasonable for their qualifications and experience. So if he did something that was not up to the standard that any other doctor reasonably would have caught, then it is malpractice.
And to answer this lady's tweet, is there a word in Swahili for medical malpractice? Would you have an idea on that?
That's going to be a challenge for me. That I'd have to refer to somebody else.
Okay, let's move on. Now,
yes.
This is very close to my heart because I did lose a cousin of mine who died 2 years ago. He was misdiagnosed. He had dengue fever, but they said he had malaria, and he ailed for quite a while until it got worse. And, you know, he had to be taken to hospital. He went into a coma. And before they actually found out it was dengue fever, he died. And the bills are usually crazy, Daktari. You can imagine over 4 million in bills. That wasn't actually our fault. Yeah. So we can say it is very worrying that we have an increased incidence of Kenyans receiving wrong diagnosis. And so my question is, why does diagnostic error happen?
Diagnostic errors, I think, can be attributed to failures in the process. In terms of enlightening our viewers in terms of how doctors arrive at a diagnosis, first of all, the patient has a role to play. The patient is the one who comes in and gives the medical history. In other words, they say, I've got these symptoms, in other words, what they're complaining of. And that is what the doctor will ask a few directed questions. And thereafter, that's how we initiate the process of establishing a diagnosis.
But is that what patients do? We're always asked, what do you have? I've got a flu, I've got a headache, I've got a fever. And immediately, something comes up. Maybe you have Lyme disease or you have this. So is it, you said it has to start with us.
Yes.
But when we go to a doctor, we actually say what is wrong with us.
Yes.
So it's the doctor's part to be, maybe say, careful on what he tells us?
Like I said, the patient has a role to play in as far as the patient has to give the right information. Sometimes, what I'm emphasizing here is there are times when the doctor, in terms of the history, doesn't get sufficient information. It is up to the doctor to be able to ask directed questions that will lead him towards the diagnosis. But other than the history part, there's the aspect of physical examination. The doctor needs to examine them, and that helps to narrow down the options. Based on the history, what we're doing is like a funneling process where we are narrowing down the diagnosis. And that's why you find, for example, the aspect of going on Dr. Google, so to speak, is never going to replace conventional medical practice.
But I think it does help, because sometimes you find you have a flu or what, and you're like, okay, causes of flu. I think Google does help sometimes.
It will help, but it doesn't go through the process in terms of history taking and physical examination especially. And after that is when the doctor, in his mind, is going through an algorithm and trying to figure out, based on the symptoms and what I've examined, what are the possibilities. He comes up with what we call a differential diagnosis. He's going to say it's going to be 3 options. It could be this, 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 and so on, isn't it? Then after that, if necessary, he'll conduct medical tests. And those medical tests then will be able to narrow it down further. So what I'm saying is, if there's anything in terms of the process that breaks down, and I want to emphasize here, the doctor-patient relationship is extremely important. For example, in the US, they did a study that showed there's something they call the 18-second rule, which I was looking at earlier, sometime last week. They said that's the average time it takes for a doctor to interrupt the patient when they're talking. That in itself limits the amount of information that the patient is going to give the doctor that's going to empower them to make the diagnosis. So in terms of being proactive, patients must also insist on being listened to. Because at the end of the day, sometimes you have patients who leave doctors' practices and say, you know what, we're not even going to take that medicine because I don't think the doctor did listen to me and therefore his diagnosis is not right. So in terms of being proactive, patients must play their role. Doctors must also try and as much as possible listen to patients. Truth is, 80% of the time doctors will get it right.
So at what point do we seek a medical opinion when it comes to a medical misdiagnosis?
You mean a second opinion?
Yes.
Well, fortunately for us, there are a lot of times misdiagnoses actually have no consequence, all right? The symptoms clear anyway, all right? But the diagnosis wasn't right. Now, then there are times when you've got unfavorable outcomes. And the time to seek a second opinion is when you see, for example, your condition is not improving despite being on the prescribed treatment. That in itself is a sign that something is not going right, isn't it? At times, of course, it is that the doctor that you saw has got certain contextual issues in terms of the constraint. You realize that medicine in the third world, especially in resource-constrained settings, are also dependent on a contribution from the patient. He might order a test. Patient might not have the money to do the test.
But Atari, sorry to interrupt, but why are very many Kenyans, when it comes to second opinion, decide to leave the country and seek for that second opinion? Is it because we have inexperienced doctors? Because medical misdiagnosis is really, it's on the rise in our country. You must agree with that. So this second opinion that you talk about, why is it that Kenyans have to, most Kenyans, rather go to India or Tanzania or in the States and get that second opinion?
That I agree is an indictment on our healthcare system. And we have got a role to play as medical professionals. We have not engendered the confidence amongst the population in terms of the quality of health services we're delivering. There are a lot of factors that are involved. First of all the time when people seek second opinions, and especially out of the country, it is also a cost issue. Yeah. So there's a cost issue. There's an aspect of quality. And in fact, the bottom line is if we want to minimize the number of people who are leaving our country to go and seek healthcare abroad, we must address the very basic reasons as to why they're leaving the country. If it's a quality issue, if it's a cost issue, those things we must address as a medical community, as private institutions and hospitals and so on and so forth. Okay,
let me go back to my co-anchor. I'm sure Eric has a few tweets. Maybe you could answer some questions from our viewers. Eric, maybe if you could share with us some of the tweets that you have.
All right, great conversation. This discussion is about you. Let's take a look at what you're saying on the social. Rodex Sylvia on Twitter, you say, in 2017, I visited a facility for a year suffering, but no illness was found. 2018, I forced them to do H. pylori tests, which became positive. All right. There's another post here from Banis Kiprop. You say, a friend suffered severe malaria, which the laboratory tests earlier had always shown no malaria, but was displaying the symptoms of the same. They misdiagnosed him with pneumonia. He went to a different facility. I think there's a continuation of your tweets there. Another tweet by Thige7, you say, at first they treated me for the chest problems, which I religiously took the medication or meds for a month, only to realize later that it was ulcers. The last one here, also on Twitter, all right, you know what? Keep tweeting at K24TV. Actually, Karen, my question to the doctor is, why are we seeing an increase in misdiagnosis or misdiagnosis cases in Kenya?
Thank you, Eric. Dr. I want to ask you a question here. Solutions for a misdiagnosis. How can we reduce these instances?
We must improve the quality of the health service we are delivering across the board. Number one, we must, one of the things we must do is make patients be more proactive and understand that it is actually their right to question. It's their right to be able to be heard. It's their right to be able to give the full information to the doctors to empower them to make the diagnosis. Secondly, we must also increase the skill set of our medical professionals, because we don't have enough. And a lot of the challenges that we have is some of the cases of misdiagnosis are actually because the diagnosis could not be reached at because the medical professional didn't have the required expertise. Even in terms of availability of specialists, there are some people who might be able to manage patients and realize they need to refer them to a specialist, but the specialists are not available. Our specialists, for example, are very unevenly distributed in this country. You might find 80% of the specialists are in Nairobi, and the other 20% are split through the rest of the country. Other than that, we must improve the kind of resources that are at disposal of our healthcare professionals to be able to improve the outcomes. And I'm talking about resources in terms of lab testing, resources in terms of any other forms of testing that are required to be able to arrive at a diagnosis, and subsequent to that, in terms of treatment and monitoring.
Could you please answer this question by Ben Kiprop? He says here, should diagnosis be made using lab test results or clinical signs and symptoms of a patient?
As I alluded to earlier, it is a history, physical examination, which is going to show the sign. History gives the symptoms, what the patient complains of. Then you've got the physical examination, which will elicit certain signs, which is what the doctor finds on examination. After that, we do tests as required, and that's how you arrive at a diagnosis.
Thank you so much, Dr. Ari.
Yes.
A very good discussion there, of course. Keep tweeting. Any experiences you have, tweet us on @K24TV. Let's take a short break. We'll be right back.
Thank you.